Welcome to Chapter 4 of Motor Development and Skill Learning. We are going to get going in a sec as soon as the slideshow will load up. And there we go. All right, cool. So early motor behavior, spontaneous movements not caused by known external stimuli. And then reflexive is stereotypical responses elicited by specific external stimuli. All right, so when you have babies, there's certain things that, and doctors will do like whenever a baby's born, they do these little reflexive tests on them to make sure everything's working well, right? And they're looking for stereotypical responses, right? But again, there's always other movements that are just, they do it, right? The baby does it, they do it. Even as adults, there's certain things that you just do for whatever reason. You just do these things, all right? But we typically see this more in early motor behavior than you will as adults. There's less chances that people have weird spontaneous movements that just occur. And even a lot of times then, like if somebody has like a little spastic movement of some sort or like some weird reaction to something, usually there's a reason behind it. But yeah, spontaneous, there's no known external stimuli for why it happened, right? Again, the videos aren't working good when I'm doing the recording, so we won't do that. In class, we'd play a lot more with these things, but because it glitches up my entire Zoom program or the Kaiser Live when we use that, we won't do it. All right. So original theory with spontaneous movements is extraneous, no purpose. Current theory is they're building blocks to some type of voluntary movements that are going to occur, right? Maybe the like in babies or something, they're working something out in their little baby brains of, okay, well, if I do this, this happens, and something where they're trying to learn, like they're like, okay, I feel this movement. Is anything happening with it, right? This would be like maybe if you're in a completely closed off room with zero light and, you're reaching up, you're reaching sideways, you're hoping to touch something so you have a spatial recognition of where you are in a room or something along those lines. Until you touch a wall, you have no idea, thinking maybe it's something along those type of lines, right? Again, not necessarily as much thought process at the baby stage, but something like that. All right. So arm movements and kicking, maybe they resemble reaching for something or resemble like walking or crawling or something with kicks and stuff like that. Reflexive movements occur quickly after onset of the stimuli. They involve a single muscle or specific muscle group or specific group of muscles. They cannot be extinguished at any one time, and persistent past normal age may indicate neurological problems. All right, so again, any of you that have ever had your reflexes tested where they used a little, I can't think of what the name of the instrument is, that little triangled hammer, rubber hammer, mallet thing that the doctor uses, and they hit your patella and it has a reflex with the kick, right? That's a reflexive movement, right? Other more developmental reflexive movements is if somebody throws a ball at your face, you have the reflexive movement of either to put your hands up to either catch or block, depending on whether you're good at catching, or you have the reflexive movement to move your head out of the way, right? That's what we think when we think reflex. There's a purpose behind it. All right, so it's a built-in response to facilitate survival, right? So if somebody fakes like they're going to hit you in the face, you flinch, right? Reflex allows dialogue with the environment, so you obviously know when a projectile is coming at you. You've had past experience of being hit with the projectile, therefore you don't allow it to bounce off your face, right? So again, you'll notice if you ever have kids, you'll notice this. So when I have little kids and my kids are standing and I have a ball, I start trying to throw to them so they catch. And, my little boys and girls, they can't catch, but they got their arms up. It bounces off their chest and their face and their stomach and everything. Just, Now, they don't like when it bounces off their face, but little kid doesn't quite get it yet, you know, and I don't throw the ball 90 miles an hour at them, so I'm not trying to hurt them, but again, it's not pleasant. Sometimes, you know, it bounces off their face and, you know, they start crying. You're like, oh, poor little guy, right? Anyways, as they get older, if I throw a ball at them, they have one of two responses, right? Now, and again, it comes to either they try to catch it, or my kids that are not as good at catching, they dodge the ball completely, right? And that's the dialogue that they have with their environment. They know ball at face, not ball at face, no bueno, right? So they determine, you know, I've got enough skill set, I'll catch it with my hands and then I will throw it back at dad, or I'm just gonna dodge it and not get hit, right? So reflexive movements result in sensory consequences, so adaptation. So they realize what happens when they do those movements, and reflexes provide building blocks for future movements. So asymmetrical tonic neck reflex. Infant starts in supine position. The stimulus turns the head to one side. Response, same side, arm and leg extend. Again, we won't watch this video, but in class, you guys watch it on your own so you can see it. Grasp and STNR. So palmar grasp reflex, you touch the palm with fingers or object. The response, they will close their hands around your finger, whatever you put in their palm. Symmetrical tonic neck reflex, infant starts in supported sitting position. Stimulus, extend head or neck, or flex head and neck. And the response is the arms extend, legs flex, arms flex, legs extend, so on and so forth. So these are certain movements that you can do with infants to see what happens, right? Moro reflex, infant starts in supine position. Stimulus, shake the head by tapping a pillow. Response, arms and legs, fingers will extend and the arms and legs will flex. Labyrinthine writing reflex, infant is supported upright. Stimulus, tilt the infant. Response, head moves to stay up. All right, so as you start laying them back down, they'll tilt their head to try to stay up. You can see this kid right here, they're tilting. Looks like I don't know. I'm colorblind. I'm guessing it looks bluish. I don't know. Maybe not pink. I don't know. It's a boy or girl. I don't care. Anyways, they're tilting the kid to the left. Kid is tilting the head to the right to try to stay up. Stepping reflex, place soles of feet on flat surface. Response, legs move in a walking pattern as soon as you do it. All right. You get a lot of parents that get really excited with that one. They think their kid, oh, he's going to be or she's going to be an early walker. No, all kids do it. Go through the reflex list in table 4.1 in your book. Again, you can figure out what voluntary behaviors they might be linked to, and again, what makes you think so, right? This isn't an assignment. I may actually add this as an assignment in the next class, though. Constraints, what constraints exist during the reflexive period? So again, going back to, I think this was chapter 1, structural, functional, environmental, physical, environmental, socio-cultural, and then tasks, goals, rules, equipment, right? We went through all those. Again, you know, understand that there's constraints at this development part of motor development. Later infancy, voluntary control of movements, understanding of the environment, objects in the environment, meaningful interactions with others, and postural reactions. So again, kids are, you know, you always hear this term, kids are sponges, and they really are. I mean, they learn so much so quick, you know, in a short amount of time, because the world is brand new. You know, you're birthed and all of a sudden you go from this dark, warm place where you can't really move much. You're being fed, you know, don't have to breathe, any of those other things. All of a sudden, you're thrust into an environment with different sounds and colors and feelings of being hot, being cold, being warm, being, you feel wind, you don't, you feel, you may feel dry sometimes, you feel wet, you poop, you feel that, all these different things going on, people in your face going goo goo gaga, and oh my gosh, right? And it all comes at once, right? So they're sponges. They start to figure out all this stuff, right? They also try to figure out how to move, like how to go towards things and get away from other things, right? So start having different actions and reactions. So postural reaction begins around 4 months. They help maintain posture in a changing environment. Initially, they're similar to reflexes, and they're incorporated into your general repertoire. More postural reactions. Derogative riding, infant starts in a supine position, turn the head to one side, or turn legs and pelvis to the other side. Response, the body follows the head in rotation, or trunk and head follow in rotation, right? So you can either move upper or move lower, and the rest of the body will follow, okay? Parachute, the infant is held upright. Stimulus, lower infant toward the ground rapidly. Response, legs and arms will extend to try to reach towards the ground, right? They get that sense of they're kind of falling, so they're trying to reach their feet there so it'll stop. Motor milestones, fundamental motor skills, building blocks leading to complex motor skills, cumulative sequential, specific movements that lead to general action. So again, certain things you see with, like you put their feet on the ground and they start pitter pattering, like maybe they'll walk, right? You start to see them if you roll them on their tummy, where they try to get their legs and arms underneath them, and as that continues, they will start to get their legs and arms more under, and they'll try to push up, or they'll try to belly crawl. Those are all motor milestones in leading to bigger movement patterns that'll come more into play, right? Again, this is some of the locomotor posture milestones. So being able to lift and hold their head in a prone position, and then later being able to also lift the shoulders up. Again, this helps towards being able to crawl. Being able to roll over, so you can get from back to stomach or stomach to back. Sitting unsupportedly, so they have the balance mechanoreceptors and everything else working to help balance and right the ship as they wobble while they sit. At 7 months, they should be able to get up on their hands and knees, start creeping their hands and knees forward. It's always fun to watch them to start to crawl. Weird fact, with 2 of my kids, they didn't had 2 of them that one of the knees, I don't know what it was, either they just felt maybe like some weird pain in the knee, or they just didn't like it, but they would actually and I don't remember if it was the same leg with both of them, but I remember one kid specifically, I think it was my middle daughter, or my second oldest, which is one of my daughters. She would use her left knee, both hands on the ground, and then she would use her right foot. She wouldn't put that knee down. And then my son did that for a while. Then he went to full crawling. Then he went back to, I don't know. I can't remember which leg he did that with. So again, you'll see some weird things sometimes, but with multiple kids. At 9 months, they start to pull up and stand. They'll use the furniture sort of like a crutch or a walker for a while, because they don't feel confident and don't have the balance to stand on their own. At 10 months, they will start to stand on their own. They'll start trying to walk soon after that, and usually by 12 months, most kids will walk. Now, again, you're seeing this. I know one of my students has a young son. Some of you don't have kids, and if I have anybody else that watches this video, future students or anything, you may be going through having kids, or you don't have them yet. These are all based on some averages. Some kids are faster or slower. And again, usually most people don't have issues with the faster. They usually worry about the slower. The slower doesn't always mean what you think it means. A lot of people think there's some developmental issues, or there's some type of problems or whatever. That's not always true. Okay, some kids just, you know, they lack the interest, whatever else. Um, Sometimes you'll have some kids, and there's actually been some literature on kids that spend more time in the crawling stage before they walk. Sometimes develop better coordination patterns. There's been, you know, again, there's a little literature out there that suggests that, and that I could see some truth to it. Um, you know, you develop better patterns of right leg, left arm movement, right, you know, left leg, right arm movements, and so on and so forth, that transition better as they walk, and you know, especially when they start running and things like that. And so again, don't worry too much. Now there's at points where you might want to worry, but you know, when your doctor tells you, oh no, they're just taking a little bit more time, don't worry, don't worry. Okay. Rate limiters or controllers. Rate limiters are individual constraints that will inhibit or slow attainment of a motor skill. Um, Again, they rapidly change during early childhood. Cultural norms can shape social interactions between infants and others and guide parental child rearing practices. So, you know, for instance, if you have an only child or that's your firstborn, sometimes it's weird, but some, you know, there's certain things that firstborns will, when they're really little, um, if say you're firstborn and say you're the only person that kind of has kids around your age or anything like that. So say you're the firstborn in your family and you're the first one to have a kid and there's not really any other little kids, there's a good chance your kid may be a little bit behind on things. And it's okay. It just happens. Um, Now, if that same kid, again, because firstborns are usually, so for whatever reason, are more determined a lot of times, and you have that kid around other kids, they will tend to develop faster a lot of times. And the reason being is they see, especially if there's a kid that's slightly older than them, right? Or, you know, because they see that kid, you know, while they're lying down, that kid's rolling over. And then, you know, at some point when they're rolling over, they see that kid up and crawling. And then they're like, I want to do that, you know. And then, you know, as things, they want to join in, right? And I've noticed with all my kids, it seemed, I felt like every one of the kids did things slightly faster, especially physically, than the kid before. And again, part of it was, is, you know, you know, I had one kid, then she had a little sister. Little sister wanted to start doing stuff with big sister, so she started picking up things fairly quick after her. And then my son, who's 4 years younger than his next closest sibling, um, he starts seeing them do stuff, and he's like, hey, I want to hang out with you guys and do things. So, you know, he kind of picked it up. And then my next son is a couple years younger than him. Same thing. He just, you know, a little bit quicker. Now, again, personalities will differ in what they pick up quicker and what they don't, you know, the things that they're interested, things they're not. So for instance, both my girls were very verbal younger too. My oldest son is a bit quiet in general. I mean, you know, he'll talk all the time now. You know, he's 6, so he talks and he talks fine. Um, but he didn't talk for a while. You know, and again, my wife would worry about things like that. But the issue was, is he just really didn't care to. Um, he was quiet, you know, and he's still quiet. But his physical pickup of things he did was more advanced than his older sisters. Their verbal pickup was more. So again, understand there's some rate limiters based on things, and it can be external, internal, right? Um, so again, crawling, reaching, walking, you know, understand what some rate limiters might be with that. Okay. Motor milestones and atypical development. Trained professionals can screen for neurological health and potential for future diseases or disorders by looking for delays. Um, Hypotonia, which is common in Down syndrome, can often result in delays of milestone skills, and delays in infant mobility could negatively affect cognitive and perceptual development. Um, Again, it's one of those, which comes first, the chicken or the egg. A lot of times the developmental delays are already there. They may use the motor stuff as a screening tool, but again, there's some movements and things that can also negatively affect cognitive perceptual, because if you don't develop certain things at a certain time, while your body is in certain developmental stages, it makes it more difficult at later stages as well. Again, we've seen this in the past. When folks were not developing at the right time, doctors really didn't know what to do. Like decades and decades ago, you see some folks that have some other developmental delays that happen now, where medicine has advanced now. They know a little bit more. They catch these things. They do, and they see better prognosis after, right? So again, what I was saying, but the chicken or the egg is sometimes, again, there's some debate whether the deficit causes the delay. And even if the delay didn't occur, because of the deficit was already there, right? And then there's some other folks saying, no, there might be a slight deficit, but if we can do some of these other things, these other aspects won't get developed. If we can get them to develop here physically, these other cognitive things might. So again, these are some things that, are a little bit up, and, there's probably truth in both, depending on what what's causing the issues, right? Sometimes it's probably the deficit first, then comes the delays, and delays may not have any interaction on the reason further developments don't happen, maybe cognitively. Vice versa, there's a slight deficit, or there's no deficit, but delays happen, which may cause some deficits, or you may have an interaction of both, depending on what it is. And again, individuality, right? Development of postural control, balance in infancy. Rate limiters for posture and balance appear to involve coupling of sensory information, motor responses. Infants continuously calibrate sensory motor responses. And again, they're continuously changing, right? And little babies grow quite rapidly, so they have constant change compared to us as adults. All right, so summary synthesis. The appearance and disappearance of infant reflexes are part of typical development. Reflexes often appear in relatively predictable sequences and timeframes during typical development. And it's important to always keep in mind the presence of the individual variability in all aspects. And again, I think that number 3, they always talk about the individual. Always keep that in mind, because again, before you, folks in our field, and actually in any field, I've seen this sometimes with people that are students in like psychology or something else, and I've had people spout things off to me sometimes. And again, I'm not really one of those folks that either one gets offended easy by any means, or two, I'd take people at, like they actually know what they're talking about. I'm kind of skeptical when I talk to people, whether or not I find that they have any intelligence. Just throwing that out there. But anyways, I've had people like tell me, oh yeah, I think you have this problem, and I'll be, a lot of times it's a student, I'm like, okay, you've met me for like 3 minutes, not one of my students, but you guys, but like some student in some other discipline, whether it's like psychology or some other medical field or something like that. Oh yeah, you have this problem, because they met me for 5 minutes, and again, they just took a class over something, and I have like 2 or 3 out of 15 signs or symptoms of something, right? And they're like, oh yeah, you have this problem, whether it's medical, mental, or whatever else, social issues or whatever. Sometimes they might be right, or sometimes I'm like, yeah, I already know that. Sometimes I'm like, oh, that's the first I've heard that. Just disclaimer, not saying anything's wrong with anything. I was talking to actually another professor at one point, and he tried to diagnose me with being autistic after the 3 to 5 minute conversation we had. I'm not saying I don't have it. I honestly don't know that I do. Nobody else in my entire life has ever thought that maybe I ought to go check for something. I'm not saying there's anything wrong with it either, so please don't look at it that way. But he really was convinced that, that I was, and he was, first he asked me, like, hey, where are you? Like, have you, like, have you been diagnosed with anything on the spectrum? And I didn't know what he's talking about. And he said, well, I mean, he's like, well, clearly, I mean, you have autism. I'm like, what do you mean clearly? I didn't, if I do, I don't know, and he goes, oh, well, you just, you have some typical signs that, you have it, and he was very convinced I have it. And maybe I do, but again, understand that it's very sometimes things are very individual, and so maybe I do have it. Maybe I have some personality aspects that are similar to that, right? And again, the reason I'm giving you guys this scenario and I'm telling this story is because, again, I don't take offense to it, because honestly, I don't think there's anything wrong with that. I've had friends in the past that are autistic, and classmates in the past that are autistic. I've worked with kids at different times in my life that are autistic. And again, and along different areas of that spectrum, and it's some of them struggle with some things, some of them do just fine in some other things, and whatever it is, that is them, right? And that's, it's what makes them them, right, as an individual. And there's, yes, for some of them, they, some folks that have it will have to have constant attention their whole life, and have somebody help them. Some folks, are very independent and successful and do well on their own, and it just depends. Again, it's a spectrum, so you have everything on that. But the reason I bring that up is, again, he wasn't looking at me as an individual. He was trying to take an individual and fit them into a grouping. And again, it's dangerous when you do those things. And like I said in this, it's dangerous to say, okay, this kid's not doing this at this exact moment, they must be this. And again, you've got to take everything else. Well, if everything else is developing on time, maybe they're just having a weird struggle with that, or maybe that's just a specific deficit, right? And again, if certain things require you to, like, be delayed on like A, B, C, and D, just because they're delayed on D, or just because they're delayed on C, or something along those lines, doesn't mean that, okay, this is what that is. All right. So I want you guys as practitioners not to jump into things right away, right? Observe it, make a note of it. If you're working in this field and you're really into doing, like the motor development stuff, but also take that kid as an individual. Like, look at all the other aspects. Maybe that for that particular kid, that's perfectly fine. Maybe you're seeing a pattern that says the otherwise, right? So again, don't just jump into those type of just like accusations and things. And again, as you get more educated, one of the things you'll learn is the more education you get and the smarter you get with things, the more you'll realize you don't know. And observing something once means you want to make a second, third, fourth observation and kind of see any other patterns and explore more before you start making diagnoses, right? So again, that I was just using that as kind of a disclaimer for you guys to understand those things, right? All right, that is it. I believe this is the last slide. Yep. So let me stop the recording and we'll do chapter 5 next.